Ebonyi cholera. 8 and 9-month-old babies left orphans. The cholera outbreak in NDUIBOKOTE village is a local government area of Ebonyi state have killed 14 persons within 3 days, alongside with 2 nursing mothers of 8-month-old baby and 9-month-old baby respectively. This left Okudiri Ogboloko, 8-month-old baby, in the hands of her sister, Izine Ogboloko of 10 years old, while Prosper Ofoke, 9 months old, in the hands of his grandmother Felicia Ofoke. These were discovered during the visitation of the Director of Family Reformation and Community Development Initiatives, FACOD, and CMD Sudan United Mission Hospital, Onueyima Agbaja, Reverend Dr. Joseph N. Wibo, and his team of health workers when they went to the affected villages to ascertain the impacts of cholera outbreak in the area. Reverend Joseph Wibo, who informed the recovered 15 patients who were treated in Sudan United Mission Hospital, Onueyima Agbaja, and IZZI branch, where 5 patients were treated early, that he is coming to see them and know how they are doing. He reached the village and noticed that there were babies, 2 babies orphaned, who their mothers died of cholera. He immediately promised to help take care of them monthly in financial ways for 6 years, which he paid 20,000 naira and 10,000 naira each for the baby for the months of November and December in this year 2024.
To ascertain the effects, the impact of the cholera outbreak that took place there a few weeks ago. To see the survival, they are undergoing a lot of trauma. And also to see how they are doing in health, and also to intimate them on the hygienic strategies so as to avoid such outbreak again, so that they will not be able to contact the disease again. What we did, we were able to go to several schools to talk to children and their teachers to avoid contacting cholera. It is a deadly disease. We discovered that apart from the patients that were brought to our own hospitals, Sudan United Mission Hospital, or Nain, and the one at Ijogo, the one at Ikriwe, there were also other health posts where they were treated. And we thank God that all of them are doing very well. Those that were treated and discharged in our hospitals, they are doing very, very well. Though they are suffering under trauma, the experience they had was not easy to come by. Then, to our greatest surprise, we discovered these 2 children. The other one is 8 months old. The other one is 9 months old. And their mothers died of cholera. And when you see these little children, it was not easy. My heart went out for them, and that is why I promised that our own NGO, Family Reformation and Community Development Initiative, will take care of them till they are of primary school age by giving them a certain amount of money every month for the next 6 years now. And then after 6 years, we will see how best we'll be able to serve them, put them in especially when you discover that their fathers had not, they don't have much to cater for these children, these innocent children. They didn't contribute anything to the death of their mothers, but we thank God that they survived, and both of them are male children. So we believe that God helping us will be able to take care of them.
The Sudan United Mission Hospitals, Reverend Dr. Joseph Wibo, offset the hospital bills of 5 persons who were treated of cholera infections in IZZI branch through the help of his friend.
Sudan United Mission Hospital, Ijogo, 5 cholera patients were treated, and we thank God that all of them survived. And their bill is 286,630 naira, and that is the money that we need to pay through our brother, Mr. Health Vok. Thank you. We didn't have enough money to go to Oneni to pay for those that were treated at Onaim or those that were treated at Ekriwe. We were only able to go to Ijogo to pay for these 5 patients that were treated there. Express my profound gratitude to my friend, Gerrit Vok. It is out of his magnanimity, kindness, and generosity that we were able to buy the drugs that we gave at Ekriwe. We gave part to Ijogo and also part to Onaim Hospital. And it was also he that paid the hospital bills of these people and also provided all those palliatives, all those things that we shared at NDUIBOKOTE. It is all by his kindness. I pray that God will continue to bless him. I also appeal to other friends of mine and those that may view this. We still have a lot to do. These people need rehabilitation.
Reverend Weibo urged the villagers to abide on the culture of good hygiene in order for them to stop the disease in the area. He has well thanked Governor Francis Ogbonnawifuru, the Commissioner for Health, Ebonyi State, Dr. Moses Ekuma, and IZZI Local Government Area Chairman, Barrister Stephen Emenike, for their support during the time of the cholera outbreak in the state.
Advice to the general public is this. During burial, we have to be very careful. You know, our tradition, the way we bury people, traditionally, is very, very deadly. It was because one woman died of cholera, and those that buried her didn't take medical precautions. And that is why it has been spreading. And the record has it that more than 50 died in several villages. And this cholera has not stopped. But people, let them take care, especially let them keep the environment clean, wash their hands after toilets, wash all the vegetables, cook very well. Whatever they are cooking, let them cook very well, and eat in a clean environment. We know that this disease is coming from contaminated water and contaminated food and so on and so forth. Let them cover their food well and avoid flies. Let them not defecate openly. They should defecate only in their toilets. And in any way they defecate openly, let them cover their feces so that these diseases will not control. And again, let them stop drinking from ponds and river water. I want to thank God for the strides our governor, His Excellency the Right Honorable Francis Ogbonnawifuru is taking, and also through the Ministry of Health, our Commissioner, Dr. Moses Ekuma, I think he's up and doing. And that is why whenever we call him, he comes readily. And also our own local government chairman, Honorable Barrister Stephen Wampa, he is also a pragmatic leader. He always takes immediate action whenever we say, hey, my chairman, it has struck here. So I thank all these people. And I want
Chief Bernard Wankwo, the village head of NDUIBOKOTE, who was equally infected by the cholera but was treated and he recovered from it, noted that the 2 babies whom their mothers died of cholera is in the village and that they didn't have money to take them to the orphanage for effective care, but managing them in the house as they could.
Ọnọdụ anyị nọ nta anaghị Chineke dọpụtara anyị abụ nwekwa bụ ndị agba mkpubi agụ ebe dọpụta ba ụmụegre ma ndị ọbụ Chineke wota n'ebe bebụrụ ndị kweshi ebe na ọfaneji ọbụghị emeghe maka obodo bata mmadụ ka ọ bụ edurube jekon anyị nọdụwara ime obodo wa ihu ụmụegre mọnụ ọ bụrụ na meda bụ ndị bụ Chineke anyị gbata anyị mkpụta anụ ọrụ na-arụbe Chineke and abọrụ n'ụzọ promotion and abịarụ.
The team, who went to 2 different schools, John Calvin Secondary School NDUIBOKOTE and Community Primary School NDUIBOKOTE, for sanitization, 120 liters of sanitary buckets, detergents and disinfectants was given to them respectively. More also, over 15 bathing buckets and 2 cartons of clean detergent was distributed to the recovered patients in the village.
Oya me igide patara nge kanta no ije ejokpo ekwo ekan ije riri ekwo ekan
blow judo nge wata anya agbakwa for agbog ani to kuni wata anya agbagbog be gbo we gbo no je first time second time self be minimum e voa and it took me in the boy about warrant to take the Unity hospital in that tilly, or warrant to Unia bear, no horon. Or Rabanda and Covarunantana, before nearly long, Bunuko she they be a neat. Like on the island and a nine. In terms of the house, the kitchen like you quit, you work the shin. Base, I say, cover and go a beshi, Makuji Bereka, the ticket, the Tajo of that thing, and the Sadra cover and Bish and
cholera that is very chronic do not affect other people further. So I'm very, very grateful for the love they have to come all the way from ABAKALIKI inside this interior to help us. I'm promising to sensitize and teach other people more what to do in order to keep the update of what we're taught here, to make their hands clean and keep their utensils clean and wash their hands anytime they go to the toilet and anytime their hand is dirty, so that they will keep away from being affected.
I'm promising them that we are going to keep ourselves good so that we are not going to contact.
Here is a rural area, it's a village. So normally one of the things that are noted in villages is ignorance. Secondly, we lack good water. So really that are mainly the causes of all this. Just the whole village, we only have one borehole. The rest are drinking from the streams and ponds. So basically that are the source to which all these things spread. Ignorance involves the way people take their hygienes for granted, like eating improperly, like the poor hand washing methods and the rate at which they manage the things they eat. Their request is good water. Good water.
Early, the health workers in Sudan United Mission Hospital, Onwenyim, Agbaja, Mrs. Kalon Ngozi, a nurse, and Mr. Peter, community health officer, maintained that they didn't have any mortality in the facility and that 50 patients which were brought to them were all treated and have all recovered. They urged the Ebonyi State government for provisions of more medical commodities in the hospital.
This incident took place on 24th September 2024. We had the outbreak of cholera in nearby community. The total number that brought to us that time were 17 in number. Then 15 was brought when the case was so intensive. Then we handled all of them. Then 2 of the out of 17 was brought in dead. So we couldn't lay hand on them. Even before they were arrived, they already died. We thank God for WHO and state and local government chairman intervention, because most of them brought so many materials like drips, that's IV infusion, and some drugs, which we used at that time to handle those cases. And they also bring some measures like water purification and other things.
That we know that this place is a referral center for such. We are pleading that most of these commodities that we need should be on ground. They should supply it for us, because as you can see here, from IZZI right down to Ndakparata and this place, there is no other secondary facility except this Sudan United Mission Hospital. So we need more help from the government, so that even human resources, we need them, so that if such thing will happen, it will not be, bulky on us.
Hey there, this is the Mirror TV. Here we offer you news on both local and international happenings. We bring you politics, religion, socio-cultural events, project work, live documentaries, documentation to your doorstep. Why don't you follow us on our YouTube channel, The Mirror TV, or you can follow us on Facebook, Instagram, or at The Mirror TV. You can as well contact us on 081-6546. The Mirror TV, time to give you the best.